Hello, Pharma friends. Welcome to Pharma Syndrome YouTube channel. In this session, I'm discussing classification of anti-epileptic drugs. The name itself indicating these are the drugs used in the treatment of epilepsy. These are drugs for the seizures. These are the drugs for the fits. And especially, already in the epilepsy, what is happening mainly, there is a increased domination of excitatory neurotransmission like glutamate, aspartate. When glutamate as well as aspartate action increased in the central nervous system, there is a increased influx of sodium and calcium into the neurons, which makes neuron more depolarized and leads to excess firing of neurons that leads to damage of neurons. What is happening in the epilepsy? In the epilepsy, there is uncontrollable contractions, movements in the body due to excess firing of total neurons in the central nervous system. And that's why in the treatment of epilepsy, we have to counteract the excitatory neurotransmission glutamate aspartate by increasing the inhibitory neurotransmission GABA as well as glycine action. Okay, so let's enter into the detail of drugs. So first, sodium channel blockers. So excess influx of sodium into the neuron may increase the firing of neurons that develops the epilepsy, nothing but seizures. So here, that's why we have to block sodium channels by using drugs like phenytoin, valproic acid, carbamazepine, lamotrigine. And next, calcium channel blocker. Excess activity of or increased activity of T-type calcium in the hypothalamic neurons may develop absence seizures, one of the type of seizures. And that's why we have to block T-type calcium channels in the hypothalamic neurons by using ethosuximide and valproic acid drugs. Next, potassium channel opener. Opening of potassium channel make cell membrane to enter into the resting phase, hyperpolarization. So that hyperpolarization is required in the CNS cells in the epileptic patient because cell have to undergo resting condition. So in that resting condition, the neuron unable to receive any impulse, and because of that there is a no conduction of impulse and no firing of the neurons. And example is ezogabine, also called as retigabine. And next is GABA agonist. As you know already, gamma aminobutyric acid is a inhibitory neurotransmitter in the central nervous system, and we have to increase the GABA action in the central nervous system for treatment of epilepsy. And benzodiazepines, barbiturates are the agonists at the GABA receptors, and they increase the GABA action. They act as a GABA agonist. They act as a GABA agonist. And next, drugs inhibit the GAT1. What is GAT1? Gamma GABA transporter 1. So GAT is nothing but GABA transporter 1. So what is the role of this transporter normally in the body? So this is the presynapse and this is the postsynapse. From the presynaptic neuron to postsynaptic neuron, the transport will bring the neurotransmitter. So here GAT means GABA transporter. But in the epilepsy treatment, you need a GABA presence in the postsynapse more time. So for this purpose, what we have to do? One of the way is to inhibit the GABA transporter. If you inhibit the GABA transporter from the postsynaptic to the presynaptic, again, the GABA will not go back. So because of inhibition of the transportation of GABA, the GABA is more time present at the postsynapse. If it is more time present at the postsynapse, it produces the inhibitory neurotransmission and reduce the neuron firing in the epileptic patient. And one of the major drug is tiagabine, that is GABA transporter 1 inhibitor, and increase the GABA time more at the postsynapse. And also miscellaneous drugs like gavacin, nipicotic acid, hyperforin. Next, GABA transaminase inhibitor. GABA transaminase inhibitor. So GABA transaminase is the enzyme responsible for metabolic degradation of GABA. But in the epilepsy, you have to increase the GABA action by inhibits its metabolic degradation. That's why our drugs like vigabatrin valproic acid inhibit the GABA transaminase enzyme and prevent the metabolic degradation of GABA and increase the content of GABA, which helps in epilepsy treatment. So if you observe clearly, vigabatrin, GA means GABA, TR means transaminase, IN means inhibitor. So vigabatrin is an inhibitor of GABA transaminase. VI means presence of vinyl group. Presence of vinyl group. And next, glutamate receptor antagonist. So what is the need to antagonize glutamate receptor? So glutamate receptors present in the ion channels as well as G protein. That's why glutamate inotropic. Glutamate metabotropic. Glutamate metabotropic means related to G protein coupled receptors. Glutamate inotropic related to ion channels. And so here felbamate blocks NMDA receptors, a subtype of glutamate inotrope, and topiramate blocks AMPA receptor, which is a subtype of ion channel, glutamate ion channel. So both these drugs block the glutamate receptor, prevent the binding of glutamate, nothing but inhibit the excitatory neurotransmission in the CNS. And next, drugs inhibiting release of glutamate. So before blocking the receptors, glutamate receptors, now inhibit the release of glutamate. So this is one of the way in the treatment of epilepsy, that is inhibit the release of glutamate from the presynaptic neuron to postsynaptic neuron. If glutamate is not releasing, the glutamate is not showing the action, there is a decreased inhibitory neurotransmission and increase of the, decreased excitatory neurotransmission, increasing of the inhibitory neurotransmission, that is GABA as well as glycine. And apart from that, GABA mimic or GABA agonist like gabapentin. Gabapentin also shows action similar to the GABA. So this is a review on the anti-epileptic drugs. So for more interesting information and updates, follow Pharma Syndrome YouTube channel and subscribe to our channel and share to your friends. Thank you.